Assalamualaikum warahmatullahi wabarakatuh. Hello ladies and gentlemen. I would like to say thank you for coming my presentation. It's a great to see you all. Okay, this is my presentation. I will discuss know the correct dosage and how to use dexamethasone. Written by Dr. Padli Rizal Makarim and published February 29, 2022. Let me introduce myself. My name is Nurul Hani Fauziah. I'm class Pharmacy 1B. I'm from Al-Ghifari University. Okay, first I will examine the dexamethasone. Dexamethasone is a strong corticosteroid drug with function to prevent the release of the substance that cause inflammation in the body. This drug is often used to treat various inflammatory conditions such as allergies and skin problems. Apart from that, dexamethasone is also often used to treat ulcerative colitis, arthritis, lupus, psoriasis, and respiratory disorders. Okay, the next slide. Dosage and how to use dexamethasone. The dose of dexamethasone varies depending on the form of the drugs, age and health condition of the sufferer. In Indonesia, dexamethasone is generally available in tablet from weighing 0.5 milligrams. One tablet strip contains thin medicine. Apart from that, dexamethasone is also available in the form of injection or injectable medicine at 5 mg per milliliters in the 200 ampoules measuring 1 milli. Next, the following is the recommended dose of dexamethasone based on the form of the drugs. Point 1. Tablets. The dose of dexamethasone in tablet is usually adjusted to age and severity of disease. For adults, the dosage can range from 0.5 to 0.9 milligrams per day, taken 2 to 4 times a day, depending on the condition of the disease. Meanwhile, for children, the recommended initial dose is 0.2 to 0.3 milligrams per kilograms. The body weight taken 3 to 4 times a day. Point 2. Injection. In general, the initial dose of dexamethasone in injection form is 0.75 milligrams a day, depending on the severity of the disease. For milder cases, the dose will be adjusted again and is generally lower. Pay attention to this before consuming dexamethasone. Before taking dexamethasone, make sure you do not have a storage drug allergies to the dexamethasone content. In addition, individuals with the health condition are generally not recommended to take dexamethasone. Liver disease or such as cirrhosis, kidney disease, thyroid disorders, malaria, diabetes, stomach ulcers, inflammatory bowel disease, depression or mental illness, congestive heart failure, high blood pressure. Beware of the side effect of using dexamethasone. Dexamethasone rarely causes side effect if used according to the on doctor recommendation. However, you still need to be aware of the blowing side effect, itching and rise, sealing of the face, lips, touch and throat, muscle tension, weakness or feeling weak, blurred vision, a faint, or saying hellos around light, shortness of breath, rapid weight gain, severe depression, usually troubles of behavior and age. Next slide. Always use dexamethasone as directed by your doctor. Follow all the currents on the prescription label and read all medication instructions listed on the instruction sheet. Dosage requirement may also change due to trigger illness, stress, or medical emergencies. Okay, in this the next slide, corticosteroid drugs work by affecting the immune system, so you may be more at risk of infection when taking them. Steroid can also worsen or reactive infection you already have. Therefore, tell your doctor about my disease or infection you experience before taking this medicine. Pregnant women and breastfeeding mothers are also not recommended to take dexamethasone. No. Okay, in this conclusion, dexamethasone is a strong corticosteroid drug that has long been used to treat allergies and autoimmune diseases such as autism, cancer, pain, and usually vomiting after surgery. After from that, dexamethasone has a very strong anti-inflammatory effect. The dose use of each person can vary depending on the type of drugs, age, and severity of the disease. Know the correct dosage and how to use dexamethasone to avoid side effects. Considering the very dangerous side effect, the use of dexamethasone must be closely monitored by a doctor. People should not buy dexamethasone with a doctor prescription. As currently, dexamethasone tablets and injection are being bought and sold online through online shopping sites. For the treatment of COVID-19, dexamethasone is only to severe and critical COVID-19 cases who are being treated in hospital. Okay, this is bibliography. Finish my presentation and say thank you. Thank you for your great attention, ladies and gentlemen. Hopefully, I can meet again soon in the future. Thank you for listening. Bye bye. Goodbye. Assalamualaikum warahmatullahi wabarakatuh.